Hello, I'm Dr. Ken Landa. Thanks for watching. Let's talk about Xanax, also known as alprazolam. It's a drug for moderate to severe anxiety or for panic. It was given marketing approval in 1981. It's considered a benzodiazepine, a sedative hypnotic, and a minor tranquilizer. Structurally, it's similar to the tricyclic antidepressants, drugs like amitriptyline. The government classifies it as a Schedule IV drug. It was originally synthesized in 1957, but it just sat on the shelf because shortly after it was discovered, the same group of individuals discovered Valium, put all the effort into Valium, and it wasn't until 20 years later that Xanax received a patent. It's estimated more than 50 million prescriptions for the drug are currently used here in the United States. It's in the top 25 of all drugs. By 2010, it became the most frequently prescribed benzodiazepine and also the most abused. It's estimated that about 5% of the population takes some kind of medicine for anxiety. But now, when we talk about anxiety, remember, this is a drug for a medical disorder. It's not for a little stress or tension. You're going to fight with your spouse or you have an exam coming. This isn't the kind of a drug that's appropriate. It's appropriate for people who have generalized anxiety disorder. It's a genetic condition that has some environmental underpinnings. It's a disease where people experience hypervigilance. They feel like they're keyed up or on edge for long periods of time. They have an exaggerated startle response and difficulty concentrating. Their mind tends to go blank. They have difficulty falling asleep, staying asleep. They have irritability. Problem is that the definition changes over time. We have the American Psychiatric Association. They published the Diagnostic and Statistical Manual, and every time they revise the book, they change the definition of the disease. And as a matter of fact, the American Psychiatric Association diagnosis differs from the International Classification of Disease diagnosis from the World Health Organization. How have we dealt with anxiety over time? Well, back in the 1910s and 20s, it was heroin and opium and morphine. Then it was changed to phenobarbital. Then in the 50s, it was Miltown. In the 60s, it was Valium. Actually, Valium was aggressively marketed as a consumer convenience. It was the first drug to reach more than $100 million in sales. But unfortunately, Valium lingers in the system for more than 100 hours and gives you a hangover effect. You can feel like a zombie. A lot of people are unable to feel and cry and even taste when they take the drug. Then we found out about abuse, addiction, and dependence. So then in the 1980s, it was the SSRIs, and people became sort of disenchanted with them. Those are drugs like Prozac and Celexa and Paxil. Then we changed to gabapentin and Lyrica and cannabis. But through it all, since the early 1980s, it's been Xanax. Xanax is an extraordinarily popular drug. It's used for anxiety, but it's also used for panic. Panic is a condition that is devastating for a significant number of people. They have a variety of symptoms. They peak within several minutes, and they cause a person not to be able to function. These people develop palpitations and pounding heart. They have excessive sweating or sensation that they're short of breath or that they're smothering or that they're choking or that they have chest pain, having a heart attack, going to die. Suffer from nausea, abdominal distress. They feel dizzy. They become lightheaded. They have chills or hot sensations. They have numbness and tingling in different parts of the body. They fear they're losing control, going crazy. They fear that they're dying. They tremble or shake. And oftentimes, panic can be associated with major depressive disorder. Well, we have to have an answer. So is the answer Xanax? Well, Xanax is a chemical. When you take it, it's going to be absorbed pretty quickly. It's going to be absorbed and reach maximum concentration in the bloodstream within about an hour or two. The half-life is about 11 hours, ranging anywhere from 6 hours on the short side to 35, 37 hours on the long side, but tends to be about 10, 11 hours. but it lasts a little bit longer in the elderly. That's why we have to be more carefully prescribing this to people over age 65. If you have liver disease, it's going to stick around in your system for even longer. And if you happen to be obese, even longer still. So the half-life in an obese individual ranges anywhere between 10 and 40 hours. Average is about 22 hours. Now, the maximum concentration of Xanax in the system is going to be about 15 to 25% higher in Asians, and the maximum concentration is going to be decreased by about 50% in people who are smoking cigarettes. It's going to be metabolized in the liver, excreted in the urine. It's not appropriate for women who are pregnant. Women who are pregnant are a special case, and unfortunately about half of the pregnancies in the United States are unplanned, so women don't, at least initially, realize they're pregnant. Well, in the last trimester, if a woman is taking the drug, it's going to get into the fetus, and the fetus can develop dependency on the drug. And that means that after delivery, the newborn can experience withdrawal symptoms, neonatal flaccidity, respiratory problems. But if a woman discontinues the drug immediately, abruptly in pregnancy, unfortunately, there are extensive withdrawal syndromes that she might face, and then there's the rebound of the underlying disorder. Special precautions are necessary in taking Xanax if a person is young, if a person has a tendency to abuse either alcohol or drugs, or if a person is old, or if a person suffers from some comorbid disease, especially respiratory disease or psychiatric disease. If you have obstructive sleep apnea or respiratory depression or cirrhosis or bipolar disorder, or if you have a neurologic condition known as myasthenia gravis, this drug isn't for you. And because it's metabolized with enzymes in the liver, well, if those enzymes are changed, maybe because you're taking erythromycin or clarithromycin or even Tagamet, cimetidine for your bad stomach, that's going to change the way the Xanax is metabolized and might get you into trouble. A woman taking a birth control pill, well, it's going to increase the concentration by about 20% of the Xanax in the system. And Prozac is going to increase the amount of Xanax in the system by about 50%. The Xanax is going to increase the concentration of tricyclic antidepressants, and unfortunately a lot of people combine multiple different kinds of drugs, but you have to be careful, especially if you're drinking alcohol. Remember, that can cause respiratory depression. This can cause we can have a problem. Kava, a popular herb, is not a drug that should be mixed with Xanax. And if you're taking St. John's wort, it's going to considerably decrease the concentration of the Xanax within the system. Now, tolerance occurs to the sedative or to the hypnotic effects of Xanax relatively quickly, oftentimes within several days. But it's still going to be effective for treating anxiety and for treating panic. There is a GABA receptor that's now sort of been nicknamed the benzodiazepine receptor. It's most widespread inhibitory receptor inside the central nervous system, and it mediates calming effects. Well, it has 5 subunits, and depending on how those 5 subunits are put together, there are 19 choices for putting these 5 subunits together. Depending on how they're put together, that sort of determines how well the drug is going to work. There is a black box in the FDA warning, and it warns that you should be extraordinarily cautious of taking Xanax with any of the opioids, because that can result in profound respiratory distress or even coma and death. So you should use only if all the other alternatives are inadequate. You should limit the dose, you should limit the duration, and you should watch for signs of respiratory depression. Well, what are the side effects of taking Xanax? Side effects are plenty. So depending on the individual, some people develop disorientation or malaise or weakness or insomnia or racing heart or lightheadedness or dizziness, or some people develop slurred speech or lack of coordination or fatigue or shallow breathing. They have impaired judgment or memory or coordination. Some people become paranoid and have suicidal thoughts when they take the drug, or develop amnesia or ataxia, difficulty walking, vertigo, dizziness, constipation. And some people develop an increased tendency, unfortunately, because of all these symptoms, to get into motor vehicle accidents. And some people, interestingly, develop what's known as a paradoxical reaction. So instead of the calming effect, some people find when they take the drug they become stimulated, hyperstimulated. They have muscle spasticity and hallucinations and agitations and rage and aggression. Some people develop mania and tremors. Actually, some people call these angry pills. Now, if you stop taking them, several things can happen. You can have a relapse of the underlying disease to the level that it was before you started taking them. You could have a rebound where the underlying symptoms become worse, they become more frequent and more intense. Or you can have withdrawal reaction. And withdrawal reaction occur when you develop symptoms that are not characteristic of that underlying disorder that you had before you started taking them. These are symptoms that tend to occur for the first time. If you abruptly discontinue the drug after you've been taking it for a while, you could develop seizures and delirium and rebound anxiety that can be quite severe. Now, if you're taking a long-acting benzodiazepine, a drug like Valium, let's say, well, 5% of the people are going to develop withdrawal syndrome after they've been taking it for less than 8 months. But if they've been taking it for more than 8 months and they stop quite quickly, quite abruptly, about 40% going to develop withdrawal syndrome. On the other hand, on a short-acting drug like Xanax, all you have to do is, within 8 weeks of taking the drug, probably 2/3, 65% or so, are going to develop withdrawal syndromes. Withdrawal syndromes can be associated with how long you've been taking the drug, the frequency of the dose of the drug, your underlying personality, whether you've been abusing other kind of drugs, and the cross-dependence to drugs like alcohol and other sedatives and hypnotics. What are the symptoms of withdrawal reaction? The symptoms include increased sensory perception, impaired concentration, clouded mental sense, develop peculiar numbness and tingling of your extremities, or muscle cramps or spasm or muscle twitches. Some people develop excessive sweating or diarrhea or blurred vision, decreased appetite, weight loss. If you discontinue them very rapidly, seizures might develop. They have to be careful, especially in people who are taking relatively high dose, especially if they've been taking the high dose for at least 3 months. Those people, very important to gradually taper. Otherwise, within 24 to 72 hours after stopping the drug, going to have some major kind of problems. Problems so severe that Xanax has gained itself a reputation as being alcohol in a pill. If you overdose on the drug, then depending on the other kind of drugs that you're taking, you may have a fatal reaction. Some people, when they overdose, can develop a decrease in the blood pressure, especially when you stand up, decrease in the reflexes. Can develop muscle weakness and impaired balance, impaired motor function, respiratory distress. And then, especially if you combine with other drugs, some people unfortunately fall into coma and die. And as a matter of fact, between 1999 and 2016, the number of overdose-related deaths that were associated with the benzodiazepines increased 8-fold. 90% of the time, if a person dies because they've been taking benzodiazepine, they have been taking, in addition, at least one opioid. And as a matter of fact, if we look at all of the people who overdose and die because they've been taking the opioids, at least 30% of them have benzodiazepine in the system. Now, unfortunately, we have a fast-paced life. We're overscheduled, overstimulated. We have an attention span that's now several seconds to minutes. Nobody can read anything more than a capsulized summary of current events. We have reason to worry. We have political situation, we have global warming, we have contaminated food, we have food poisoning, we have social media. Well, we had a situation when both Xanax and Valium were introduced. They were thought of as safe and without any kind of associated problems. But now we think otherwise, and as a matter of fact, even though people tend to worry about addiction to Valium, addiction to Xanax is much more common. It's much more common because it has high affinity binding, it has high potency, it has a very short half-life, and it has a very rapid onset of action. So how much should you take? Well, assuming you have a medical disease and you're not taking it just because, oh my goodness, I'm going to have to go and see the in-laws and I'm stressing over that, so I pop a pill. But if you have a medical disease, if you have generalized anxiety disorder, if you have panic, the dose might be somewhere in the order of 0.25 to 0.5 milligrams taken 3 or 4 times a day. The amount can be increased at 3 to 4 or 5 day intervals, should not be increased by more than 1 milligram at a time. The maximum for generalized anxiety disorder should be 4 milligrams a day. If you have panic disorder, we'd like to keep it below 4 milligrams, but unfortunately most of the people who have panic attacks seem to be taking 5 or even 6 milligrams a day. Once you start taking the drug, it's going to eliminate the panic within a day and a half to 3 or 4 days. But if you've been taking the medicine for a while, periodically you should reevaluate, or the doctor should reevaluate the need for the drug, decide if you still need it. And people, especially who are taking the higher doses, oftentimes can have the dose reduced by 50% without suffering any other kind of problem. Now, some people complain that in the morning they're anxious, but they're okay during the day. Do you need a higher dose? Typically, no, you don't need a higher dose. You need to space out the drug a little bit better. And that oftentimes is quite sufficient. Now, you have to remember, this is a medical drug, and it's for medical disease. It's not for you just being periodically restless or impatient. That's not a disease. That's just normal life. You have to realize that we have a significant problem with abuse. This is among the top 3 drugs for diversion. It's easier to get for kids even than alcohol oftentimes. There's the internet, the dark web. You have dealers and social media. You can buy a bar for $4. If you use this, you don't need any paraphernalia. The problem is, unfortunately, that the Xanax you buy or the alprazolam you buy over the counter or off, not through medical means, through a pusher, through an individual. Well, unfortunately, it's oftentimes contaminated and counterfeit. And it can contain fentanyl or heroin or carfentanil. These fakes often made in China or India or even by entrepreneurs who have their do-it-themselves presses. That's unfortunate because that's where a lot of problem comes in. Now, unfortunately, some people like to inject drugs. This is not one to inject. It's not water soluble. It doesn't fully dissolve. So if you inject it, it's going to embolize to your liver, your lungs, or your brain. You're going to have problems. You have to be very careful of these drugs. Drugs that have nicknames assigned to them, Xannies or blue footballs or blues or ladders or Z-bars or Xan bars or even bricks or just plain benzos. You have to realize that a significant number of people going to the emergency rooms because they're having reactions involving these drugs. And unfortunately, they're frequently mixed with other psychoactive substances. The amphetamines are cocaine or MDMA or heroin, opioids or marijuana, LSD. You have to be extraordinarily careful of these drugs. These are real drugs for real disease. And unfortunately, when they're abused, sometimes they're abused as date rape drugs. They were thought to be hip for a long time. Even in one of the Rolling Stones songs, Mother's Little Helpers, they were sort of featured. But then we had deaths of some of the singers in the popular era. We had Amy Winehouse, We had Brittany Murphy and Whitney Houston, and we had Heath Ledger. And all of a sudden, things started to change, at least as far as the hip-hop culture was concerned, when Lil Peep died of abuse of these medications. Well, you have to be extraordinarily careful mixing drugs. So if you use a benzodiazepine within 12 hours of using heroin, your likelihood of overdose increases 2,800% versus if you didn't take the benzodiazepine. The benzodiazepines are relatively inexpensive, can be purchased a month's supply for $20, $30 at the pharmacy. Unfortunately, in our society, where almost everyone experiences some sort of anxiety, we're all too ready to reach for the solution to life's problems in the form of a pill. But remember, these pills aren't for mild social ills. They're oftentimes habit-forming, and they come with a wide array of potentially serious complications, so be careful. And you have to question whether the 5-minute session that you have with the family doctor, the nurse practitioner, the PA, is really adequate to evaluate whether you're suffering from a significant medical disorder that needs a pill, or whether you'd best be served through some other means. Anyway, thanks for watching. I'm Dr. Ken Landau.